All right, before we tackle this blood sugar stimuli, a couple of things very briefly. The first thing is before or before, same sign, before or before, same sign, depending on what timeline you're using, versus before, okay, or before, okay? So this before means something happened, it's before this thing happened. So I might say, before I discuss stimuli or stimulus, I want to discuss whatever. Before this happens, then whatever. Versus this just means in the past. So when you can replace the word before with the word past, then it's this sign past. So yeah, I've been there before. I was there in the past, before, in the past. Okay. This sign is even or fair or just, as in fair, just, not just, or not just, but just, fair. Level is levels, level, two movements, level. So if you wanted to say like check blood sugar levels, it's like this, level, not just level, not just fair or even. And one thing specifically regarding constructed dialogues, very common. Once you start working on properly producing constructed dialogues, and just to be clear, that not every deaf person properly produces constructed dialogues, and not every hearing person, interpreter, what have you, produces them correctly. I'm trying to really emphasize the right way to do it so that your rote execution of constructed dialogues is the right, by the book, proper, grammatically correct way. Of course, sometimes they're going to come out other ways, and that's natural, that's language. Everything happens very quickly, but it's important for you to know the right way. What happens when you work on, when you start, practicing them, once you start eliminating signs like he said, or he told me, or I told him, once those signs go, interpreters, we all feel this need to put something in there, like the nurse, she, I shouldn't sign said, I'm not supposed to do that, so I want to do this, or I want to do this, or I want to do, and usually one of those signs, it's another one people do a lot, the instinct is to put something in there, and a role shift technically does not need those things. And in fact, when you put in this, or when you put in this, or when you put in this, or whatever your kind of go-to transition sign to a role shift ends up being, all of those signs have grammatical implications. It's a sign, those signs have meaning. And so you're adding meaning when you don't necessarily need it. Now, granted, it's not wrong when it's grammatically appropriate to use this sign or to use that sign. If the person was trying to remind or urge someone to do something, then this sign means that. So that would be an appropriate use of that word if that's, in the message. Or if the person is trying to get their attention, hey, listen, then if that fits the message, hey, then you can put that in there. But it doesn't, usually it's not gonna be the case. They're not gonna always be urging or always be saying, hey, they're just gonna make a comment. And so you just shift and make the comment, okay? And keep in mind that shifting can simply be, okay, let me say something else really quickly. When I use the terms role shift and I use the term constructed dialogue, those two are synonymous to me. A lot, and perhaps erroneously, but I do use them interchangeably. So, and a lot of people look at role shifts and think the word shift means a body shift, but shift doesn't mean that. It means shift. It means the role that you are assuming is shifting, is changing. So right now I'm narrator and I'm going to shift to the mother, or I'm going to shift to the nurse, or I'm going to shift and become the nurse, meaning my whole who I am, I'm going to throw on this cloak of somebody else, okay? So, so you can role shift and not actually move your body. And that shift can happen because your non-manuals change and you assume maybe it's an old lady and you're like, ooh, or maybe it's mom and she's like, that your personality changes and that shifts your character. Okay, so it's not always just, you don't have to actually move your body. And if you really study deaf people, oftentimes their shifts happen very subtly with a non-manual, not an actual body shift. Question, Patricia? Nope. Okay. Let's dive into the stimulus. First sentence. Before you left last time, I said, make sure you come back in 4 weeks so I can see if your blood sugar is more controlled. Okay. So we have, we're going to be focusing on constructed dialogues. So we have, before you left last time, yeah, so appointment before, sure. Appointment before could work. That's what I have. I have it flipped around. So I have before your appointment. That works too. I kind of want to sign this sign, right? Because this sign, this sign means something more recent, where before just means in the past. So to be a little bit more accurate, this sign or even this sign can mean your most recent appointment. This, your appointment. Okay, so we have that before you left last time. I said, make sure you come back in 4 weeks. So we're gonna role shift and become the speaker, but what the speaker did what the speaker did at the previous appointment. So we have before your appointment, right? And then to do the role shift, I'm gonna assign, here's what I did. So just point to me saying, this is what I did. What I did was, make sure you come back in 4 weeks. So in 4 weeks, okay, in 4 weeks, just like I do next week like this, in 2 weeks, in 3 weeks, in 4 weeks. Okay, so in 4 weeks, you could also do in 4 weeks if you sign next week like that. You could also do 4 weeks coming up. Those 3 work for in 4 weeks. So here's what I did. In 4 weeks, you can sign you back must, okay? Or you come here, should, something like that. Any other suggestions for that part? Okay, so in 4 weeks, you sit with me again, sure. In 4 weeks, you, again, absolutely that works. So make sure you come back in 4 weeks. That's the first part of the quote. So I can see if your blood sugar is more controlled, okay? And with controlling your blood sugar, you could think of it as with somebody who has diabetes, their blood sugar is all over the place. So this is kind of an uncontrolled blood sugar. And then this is a controlled blood sugar, or this might be out of control blood sugar, or out of control blood sugar maybe. Because that's, that's the dangers. It keeps going up and we need to bring it down, control it better, whatever your perception is of blood sugar. And actually, if you were actually in the appointment, you'd probably know which of those interpretations match that actual patient best. But I'm gonna say their blood sugar is fluctuating and we wanna level it out to control it. Okay, so we have, so I see if your blood sugar is more controlled. So we have, your blood sugar, you could do must, level, up and down. And if I do up and down, because that's the wrong way, I'm gonna do, that instantly tells the audience, this is not what we want, not, okay? So your blood sugar level should not, okay? Or up and down, don't want, you could do that too. Don't want, okay? let's see if that's all we need for that. I'm gonna do the whole thing. So we have recently your appointment. Here's what I did. In 4 weeks, you again should. Your blood sugar, want, don't want. Okay, maybe that works. All right, next sentence. Next sentence is, it's been 3 months. So the doctor just said, you're supposed to come back in 4 weeks, but it's been 3 months. So a simple little sentence. You could sign something like, up until now, 3 months. Okay, that could work. Now, there is something implied in that little tiny little sentence. What is the doctor actually saying? What's implied in that?
That he's saying that I gave you this time span and you went over it. Like,
yes, absolutely, because it's been 3 months, are 4 tiny little words, 5 tiny little words. And if I were saying, yeah, I'm dating this guy and it's been 3 months, those exact same 5 words, totally different meaning, totally different intention, exact same 5 words. So always think about intention, and if there's anything implied in there, since ASL is a much more explicit language, try to put that in there. So a better interpretation than just it's been 3 months would be something like, it's been 3 months, you keep putting it off. Or, and this sign postpone can be signed postpone this way, or postpone this way, or forward. And even one-hand or two-hand, I see them all. So 1 forward, or 2 forward, or to this, both to the side. I've never seen 1 to the side. It's always both to the side if you're gonna use that timeline. Okay, so adding a sign like postpone gets that implied message out.
when would you use to the side? Because I know that, like, in our ITPs, we're taught, like, our body's the timeline, past, present, future. So, like, I would automatically just go forward, but when would you go to the side?
There are 2 timelines. So I think that I was primarily taught front to back timeline too, but there are 2 solid timelines. You can go side to side, I mean like this way, or you can go this way. And almost every time sign, you could flip it and use this one. Yeah, a lot. Like if I did like this versus this, almost everything, this is the past. So to the left of my body is past, and this is moving to the present and moving to the future, to the right. I tend to feel more comfortable with this one because this is what I was taught. But many years ago when I had a mentor, and I think, Patricia, you would know who this person is, she said to me, why do you never use this timeline? So ever since then, I've been trying to just to get much more comfortable with this timeline, but I'm still more comfortable with this one. Yeah. Okay, next sentence. Remember what Sue, the nurse, said? She said, sorry, I'm pausing just to see if I should stop there, but I'm gonna keep going. Remember what Sue, the nurse, said? She said, it's so easy to pass out when your blood sugar drops too low. Okay, so we have this person that's saying something, so we wanna make sure that we set her up right away. So we have, you might start with remember, or you could just start with Sue. So we have Sue, I'm gonna set her up. And since we're gonna talk a little bit about her by kind of explaining what she does, she's the nurse, I'm gonna do Sue, herself, nurse, okay? So now we have Sue set up and we've explained who she is. Sue, herself, nurse. And actually, I added a sign that's not necessary, just so you know, this sign, herself, himself, itself, sets the entity up without needing the index before. So you could just do Sue, herself, nurse, and then this is what she said, and then you can talk. So you can do either way. And the remember you could put at the beginning of a sentence or right before you roll shift. Remember she, and then you would do the roll shift. Now, so I'll start to do that whole thing again. I'll do the remember first. Remember Sue, herself, nurse, she, And then what she said was, it's so easy to pass out when your blood sugar drops too low. Now, how do I want to put this? Since, I'm just going to say it, since she's warning of something, you might want to start off with a warning. You might want it. You don't have to, but you could. So you could say she, and notice that nothing else is happening here. It's just she, warning, your blood sugar pass out, can, something like that. Okay, this is the sign pass out, by the way, pass out. This is a slightly different sign. Well, this sign means like shock. The sign means pass out. So we have, remember Sue herself, nurse, she, blood sugar plummet, non-manual, pass out, can. Okay, that's the first part. And then the end of the sentence is, and I agreed with her. Okay, so me as the speaker, I'm gonna become myself in that conversation that happened 3 months ago. I'm gonna say, here's what I did, and then the most logical agreement, yeah, right, done, exactly, okay? So Sue said this, and then I, right, yep, that's it, and that's it. That's the end of that sentence. Next sentence. So let me take a look at your blood sugar log. I played around with this sentence a lot, oddly enough. It's a short one, but I play with different ones. So realistically, I would probably just sign your log, and I've actually interpreted a lot of diabetes consultations for some reason, and the people that I'm interpreting for just are so aware of these logs, because doctors do really they really want to take a look at this log, and so your log is usually enough. So your log, and you may sign, if you needed to expand on it for some reason, you might want to sign numbers, just in case they weren't sure what log you're talking about, okay? Let me take a look at your log. I would just sign, give it to me. And that's it. Just give it to me. You might want to sign, give it to me, and I will look at it. Me, take a look at. But I don't even think the me take a look at it is necessary, but it's fine. So your log numbers, you give it to me. Let me take a look at your blood sugar log. Yeah. Of course, that interpretation would be totally different if the blood sugar log was sitting right there on the desk in front of them, and the doctor wasn't saying that to say, give it to me. The doctor was saying that to say, I'm done lecturing right now. Let me take a second, take a look at this thing, right? Because sometimes people talk and they go, okay, so let me just take a look at this here. It's already there. If it's already there, then Patricia, what could the interpretation be? Not to put you on the spot. Yeah, I mean, their goal's sitting there, and the log is right there on the table. And so she says, so let me take a look at your blood sugar log. It really could just be, now I'll look at this. Now I'll look at this. Yeah, it's right there. I'll look at that. I really, to be honest with you, couldn't really see what you signed a second ago because it kind of froze. No, it's not your fault. It just froze up in the middle. Okay, last sentence. Let me just say something really quickly about that last sentence. When doing medical interpreting, really when doing any interpreting, but specifically medical, there are so many visual things that are going on, and a lot of newbies have a tendency to want to oversign unnecessarily. Meaning, receptionist gives them something to sign, the paper is right in front of the deaf person, the receptionist says the sentence, go ahead and sign there, please. The deaf person signed things a million times. There may not even be a need to sign anything. The paper's right there, there's a line at the bottom. They know what they have to do, right? If they're looking at you like, so what am I supposed to do with that? Which I'm telling you that's never gonna happen because everybody's signed things their whole life. What am I supposed to do with this? sign, right? But that's not even going to be necessary. You put it there, sign. What ends up happening is, and I've done it plenty of times, I pick my hands up because they think, oh, something important's been said. And so they look at you and they're like, oh yeah, obviously. I knew that, right? The same thing with the scale. You walk back, follow the nurse back, or follow the nurse back, and then the nurse says, okay, I have to get your weight, and the scale's literally right there. For their whole lives, they've seen scales, they know what to do, they've been going to doctor's appointments, so you just go do what you know what to do on the scale. So those kinds of things, if it's visual, don't feel the need to oversign. It could almost be disruptive to the appointment. Okay. Last sentence. Your wife told me I'll make sure he documents his blood sugar 3 times a day, every single day. Did she? Okay, so we have a second person to set up, so let's go ahead and set her up. Before your wife, she, okay. And even the time is not so necessary. It's a little bit redundant because we know if it's a quote, it means it's happened already. She couldn't quote in the future. So you could just say, your wife, she, and then you're going to shift. And wait, she said, I'll make sure he documents his blood sugar 3 times a day, every single day. Okay. A lot of ways you can approach this sentence. How did you start yours, Patricia?
Honestly, I did what I wasn't supposed to do, and I did that thing. I did this, and I was like, I said something about every day, 3 times, force him will, or something like that.
Okay. I mean, this could work grammatically. She's kind of going to get on him about it. You better do this. So she, this is probably a better sign because she's trying to remind him to do this every single day. But there's that's a close match. So she, and then you're going to shift to her. Me, will, morning, noon, night, prick, prick, document, every day, will, something like that. So I'm going to get on him. I'm going to remind him, and I'm signing it this way because we're talking about him. He's right. So it's speaker, deaf person right there, and I have the wife here. So when I shift to her, we're still talking about him. So it's him that's going to be reminded. Okay. She's looking at the doctor, but she's talking about him. So, so she, is it, oh, wife. Your wife, she, me, will, remind, morning, noon, night, prick, document, every day, that. Yeah. Oh, put down, that's the important part, put down. So, that's the whole quote, okay? Sometimes it's confusing me when I have my voice on, but I only have my voice on because I know the video gets stuttery sometimes. And then the last part of that is, did she? Okay, so your wife said that she was gonna remind you to do this thing. Did she do that? Did she remind you? A million ways you could interpret did she. What did you just say? Yeah, happen, good, happen, I like that. And the wiggle finger fits there because it's like this, like, did she really do that thing? So it's a real questioning. It's not just I'm putting in the finger just because there's a question mark at the end of the sentence. There's a real grammatical purpose for that sign and it fits. You could do so happen or true biz happen. That could work too. I saw some much longer interpretations in videos that were unnecessary but still grammatically worked, like she every day remind you did or something like that. You know, it works, but it's not necessary. But I think happen, I saw somebody just do happen eyebrows up, and that's enough too. So that is it. That's the whole thing.
Yeah. For the last sentence, I think I did all 3. I did true work happen. I did all 3.
Yep, that works. Absolutely. It's good. I always think that practicing being concise when concise works is always beneficial, but it's not always necessary. But it is good practice. But sometimes when we're interpreting, it's really a good tool to have in our toolbox to be able to truncate when necessary. Because oftentimes we have to do expansions a lot. You know, sometimes are really necessary for the message to come across clearly, and so it ends up getting us behind more than we might be comfortable. And so being able to go happen and know that you can do that and it's clear and works and, you know, beautiful can save us a little bit of time. But it doesn't really, ultimately doesn't hurt the interpretation one way or the other. Cool. Okay. Please, everybody, send in. You can send in both interpretations, because the first one, although that I provided a demo for that, it doesn't hurt to just do that drill and practice it. Especially for those of you who are working interpreters, watch my demo and then do it better. That's a basic interpretation. There's lots that you could tweak, improve on, make it more visual, get creative, make it more concise, whatever you feel like you know, works and still the message matches and you're still doing role shifts and those kinds of things. And then, of course, when you feel comfortable with the second one, the one that we just went over, then send that one in too. And again, make sure you are practicing. One thing I want to make sure to emphasize is that the goal is to produce your constructed dialogues clearly and without those crutch signs of said and tell and inform. Just go right into the role shift and do it. And please watch your own interpretations. Make sure that when you send it in that there are no saids in there, or tells in there, informs in there. Sometimes they sneak in, you don't even realize, you're like, I don't remember even signing that. So it happens all the time. So just watch it yourself and go, oh, let me do that again. So that when you send it in, there's no saids, there's no tells, there's no informs on any of that stuff. Final questions? Thanks for showing up. Thanks for watching. Bye.